Many survivors who were smashed by falling buildings or trapped under rubble have very serious injuries. And doctors and nurses, they're forced into decisions that could forever change patients' lives, but could also save their lives. Our chief medical correspondent, Dr. Sanjay Gupta, is in Port-au-Prince. He's joining us now with more. These are, for a doctor, for a nurse, these are such difficult decisions, Sanjay, that have to be made very quickly.
That's right. I mean, sometimes even at the scene, Wolf, and they are tough decisions, keeping in mind, of course, everything that goes around this, post-operative care or lack thereof, the right sort of instruments. They're called crush injuries, and we're seeing more of this than I think just about anybody expected. Here's what we found. Just such dramatic injuries a week out, and these patients are so at risk. I mean, look, they're out in this blazing hot sun. No IVs hanging, significant injuries, and really no home to go to either. So you can really see what's happening here. And just patient after patient. It's
If head injuries are the hallmark of the war in Afghanistan, the Haiti earthquake will be known for crush injuries. Doctors amputated 17-year-old Izamine's arm 3 days after the quake. In her case, there was no question. But with such severe injuries over and over again, doctors are faced with a tough choice: to cut or not to cut. Like this 10-year-old boy, Desgrave. He is beaten down, looks awful, but his limb still moves.
Well, the initial instinct for most people, try and save the leg. It'd be too morbid not to. We also know now that's not always the right answer. Infection, gangrene, crush syndrome.
Crush syndrome is a simple name for a condition called rhabdomyolysis. After your muscle is crushed, it can start to break down, releasing these particles into the bloodstream, cause kidney failure, very high potassium levels, even cardiac arrest. So removing a limb could mean saving a life. Here in Haiti, crush injuries are everywhere, and amputations at the scene to rescue someone, or here in hospitals like this. But how do doctors decide whether to cut or not? Some clues: obviously dead skin, blisters like this, or a crush that simply lasted too long. In the case of Desgrave, he had all those things, and he was also severely dehydrated. That made his condition even worse. So last night, Desgrave did lose his right arm. But remember, that is also probably what saved his life.
You know, and again, Wolf, you wish that you had the proper instruments to perform these amputations, even things like having blood. These can sometimes be bloody operations. That doesn't exist in many of these hospitals. And again, prosthetics, rehabilitation, just standard post-operative care, a lot of that is non-existent as well. So, Wolf, they're saving lives, but there's a lot more, as you might imagine, to this entire process.
And what about pain medication and anesthesiology? Are those things available readily?
Minimally available. In fact, some of the debridements where they actually take off some of the dead skin initially are often done without anesthesia, and that is very tough to watch. They do give medications that are known as dissociatives, sometimes dissociating your mind from your body. So it's not really a pain medication, it just sort of makes you less aware of what's happening. General anesthesia, you know, putting a breathing tube in and then using general anesthesia, I haven't seen that yet. So they're getting there, Wolf, though. I mean, it seems to be better even at the hospital where that report came from today versus yesterday. It's slowly improving, but, you know, a long way to go, Wolf.
Last night, you and Anderson were talking about the perhaps thousands of deaths a day, needless deaths, because of a lack of medical equipment or medical supplies or doctors and nurses. When I heard that last night, I was shocked, but what did we learn today?
Well, you know, it's hard to pinpoint a number on this, and some people say it's thousands, some people say it's more in the hundreds. It's really hard to say what the preventable death number really is. But there's no question, for example, something that might be a rather innocuous cut or a scrape even on someone's hand, if it's untreated, not even washed out, and someone is living in these conditions, that can turn into a problem very quickly, even leading to gangrene and then all the problems that you saw in that piece there. So is that a preventable death? Absolutely. Is that something that could have been prevented with antibiotics early on? Sure. But you know, again, these types of amputations being necessary early on, the treatment of infections and pain medications, it's getting better, but again, not enough of it.